Webinar, Success in Our Midst. My name is Liz Jackson. I'm the Senior Research and Scholarship Specialist for the Foundation for Physical Therapy Research. Thank you for joining us. We'd love to know where you're tuning in from. Feel free to list your school in the comments for a shout out. And we plan to tell you about the 11 mechanisms we have for support of your research in the next 30 minutes and share with you a couple of stories from successful previously supported researchers who took their support and turned it into published work that is helping patients lead healthier, stronger lives. Next. As I said, my name is Liz Jackson. I, along with Faith Oediapo, Stuart Bender McLeod, and the research committee of the foundation, lead our scholarships and research grant programs. Joining us today are Kari Dunning, PT PhD, a 2012 Magistro Family Foundation awardee, and Pierce Boyne, DPT PhD, a 2014 Promotion of Doctoral Studies recipient, both from the University of Cincinnati. Faith?
Hi, everyone. I'm Faith Oyedepo. I'm representing the Foundation for Physical Therapy Research. First, we're going to hear a few words from Dr. Stuart Binder McLeod. He is a past foundation funding recipient and current trustee. He served as professor and chair of physical therapy at the University of Delaware. He is the associate vice president for clinical and translational research at the University of Delaware. He went on to lead Delaware's clinical and translational ASAL program, a 10-year, $50 million program funded by the National Institutes of Health and the state of Delaware to facilitate the growth of clinical and translational research. He's also a former editorial board member for APTA's Physical Therapy Journal. Dr. Binder McLeod's research laboratory was continuously funded by the National Institutes of Health for over 2 decades. He received the 2019 Francis Allison Faculty Award, the University of Delaware's highest competitive faculty honor. He delivered the 51st Macmillan Lecture in 2020. Binder McLeod's connection to the foundation goes back to 1989 when he received a 2-year research grant. He volunteered on the foundation's scientific review committee from 1998 to 2001 and currently serves as the chair of the research committee and has been elected vice president of the foundation's board of trustees. Welcome, Dr. Binder McLeod.
Thank you so much, Faith. I really appreciate that introduction. So as Liz mentioned, we just want to welcome everyone here to the seminar. I just want to note, as you can see in the slide in front of you, the foundation is the only national profit organization solely dedicated to physical therapy research. And we use a rigorous peer-reviewed process to select and fund not only the most promising applicants, but also the most promising applications across the entire range of physical therapy practice. We're proud to say that since the foundation was founded in the mid-70s, we've funded over $2.2 million in research grants, fellowships, and scholarships, which means we funded over a total of 688 researchers. And those researchers have gone on to garner over $896 million in follow-up funding. So I think we've done a great job of selecting individuals capable of moving the research agenda. Thank you. Next. So these are, as Liz mentioned, there are 11 different mechanisms that are available for funding this year. There's a total of 15, and not every mechanism is offered every year. But this year, this is a rather robust group. What I do want to call to your attention are the first 3 grant mechanisms listed in this list, which is the Magistro Family Foundation Research Grant, the Paris Patler Physical Therapy Research Grant, and the Paris Patler Manual Physical Therapy Grant. I want to mention those in particular, not only because they're the most robust in terms of offering $100,000 in funding, but specifically because you'll need a letter of intent for each of those. Those letters of intent are due June 15th, and the full applications for all of the mechanisms. So if you've been invited to submit one of those $100,000 grants, or for the remaining grants, they're due on August 8th. A couple of key things I just want to remind everyone that in order to apply for grants, you have to be a member of the American Physical Therapy Association. And also something new we started this year is that for many of the grants, you also need to be a member of the component that is sponsoring the grant. And that's true for several of the mechanisms. For instance, the pediatric research grant or the acute care research grant. There are other grants which are not tied to any one particular component, and therefore you do not need to be, there's no membership required. Okay, thanks. Back to you, Faith.
Thank you, Stuart. Today, as Liz mentioned, we're going to hear from a successful past recipient of the 2012 Magistral Family Foundation Research Grant, Dr. Carrie Dunning, as well as a 2014 Promotion of Doctoral Studies Scholarship recipient, Dr. Pierce Boyne, and they will both discuss their work titled High Intensity Interval Training in Chronic Stroke.
Thank you. Yeah, we're really excited to be here to be able to share an overview of the work that we did that really was propelled forward by foundation support, focused on high intensity interval training, or HIIT, in stroke rehabilitation. So this research started based on some emerging evidence at the time that more vigorous or intensity training might be helpful for improving gait outcomes after stroke. And by vigorous intensity, I mean, faster walking speed during training or higher heart rate responses or aerobic intensity. At the time, though, nobody had really thought about doing HIIT in stroke. It had really burgeoned a lot in the exercise science literature, where people are using these bursts of intense effort alternated with recovery periods to get to higher intensities than are possible with continuous exercise. And we thought that seemed like a great idea based on what was emerging in the stroke literature for possibly improving gait outcomes after stroke. So based on that premise, we assembled a team, including an exercise physiologist, a cardiologist, a neurologist, in addition to our physical therapy team, to really get all the expertise needed in the room to develop ideas and start submitting manuscripts and grant applications to get this science moving forward. And next slide, please. Some of the earliest support came directly from the foundation. So we Carrie applied for a Magistro Family Foundation research grant and was awarded it. I was a co-investigator on that. And then I had a PODS 1 award that also supported this line of research, and my PhD studies, where Carrie was my primary mentor. So next slide, please. I want to share just some of the, I'll stay out of the weeds, but I want to share some of the preliminary work that was supported by the foundation that led to larger scale studies later on. So this was the very first trial we did testing high intensity interval training post-stroke, where we were really trying to figure out what's the best way to implement HIIT in this population on the treadmill. We didn't know how much recovery people would need to get to their highest heart rates, highest speeds, and highest stepping repetitions on the treadmill. And so we compared 3 different protocols. Each participant did each one for 1 session in random order. Next slide, please. And what we saw was that shorter recovery, the red bars on this graph, gave the highest aerobic intensity, the highest repetition of stepping practice. But as you can see on the right side, there were significantly lower treadmill speeds, probably because of fatigue, with less recovery in that protocol. And so based on this work, we developed a more optimal protocol that we used in subsequent studies that starts with 60 seconds of recovery to ramp up treadmill speeds to the person's individual limit, and then decreases that recovery to 30 seconds to maximize stepping repetition and aerobic intensity during training. Next slide, please. The next study we did, supported by the foundation, was a pilot randomized trial that carried that protocol forward in comparison with moderate intensity aerobic training, or MAT, which was the current best practice recommendation for post-stroke exercise. And we did a really short protocol that wasn't really enough to see results with MAT, but we did see some really robust preliminary effects with HIT in this study. And primarily what the study did was showed that it was feasible for us to do a randomized trial with this in this line of research, but it also gave some really promising preliminary effect sizes that justified subsequent work and applications and led to publications, including this one in the Physical Therapy Journal. So this was just one of the preliminary results. We saw significantly greater improvement in aerobic capacity as measured by the ventilatory threshold in HIT versus moderate intensity training, even with this small sample size pilot trial. Next slide, please. And we also saw significantly greater improvement in fastest treadmill walking speed. Next slide. The last study I just want to give a brief overview of was one that I did later on in my PhD training, really starting to look at mechanisms that might explain why more vigorous intensity training might be more effective than more moderate intensity training for people with stroke. So we were looking at blood biomarkers related to neuroplasticity and also transcranial magnetic stimulation measures of neuromotor activation in the corticospinal tract affected by stroke. So we measured those things before, during, and after single sessions of different exercise protocols, including high-intensity interval training and moderate-intensity exercise. Next slide. And what we saw was that there were some significant intensity-dependent effects on some of these molecules related to neuroplasticity, including lactate, brain-derived neurotrophic factor, and vascular endothelial growth factor, which had significantly greater increases with vigorous intensity training than they showed with moderate intensity training, giving some indication that of why we might see better gains in some outcomes with more vigorous intensity exercise after stroke. Next slide. And then similarly, when we looked at motor threshold changes with transcranial magnetic stimulation, we saw significantly greater decreases in motor threshold with HIT versus moderate intensity exercise, indicating greater neuromotor activation during the exercise period. So these were just some interesting preliminary findings that led to lots of publications and then to subsequent grant applications. Next slide. And here's just a list of some of those. So right after those studies, we did, Carrie was successfully applied for a University of Cincinnati Neuroscience Institute Pilot Award. I got an American Heart Association Career Development Award. And then a big boost for this line of research was I got an NIH KL2 Career Development Award that really focused on developing more MRI imaging biomarkers for locomotor recovery after stroke. And then the biggest one really was our NIH R01 that came directly from that foundation supported study that I showed earlier, the pilot randomized trial. This R01 was a 3-site study with 55 participants randomized to high-intensity interval training or moderate-intensity exercise. So really just the direct extension of that pilot trial funded by the foundation. And we found that basically the primary outcome was that, the primary finding was that HIT gave more than twice as much improvement in walking speed and endurance than moderate intensity exercise, which is the current kind of best practice recommendation for exercise post-stroke. So it was a really major finding that led to a publication in JAMA Neurology. And we submitted a renewal application that has been selected for funding to do an even larger trial that should give even more definitive evidence to guide practice about what's the optimal intensity for gait training to recover walking capacity after stroke. So really, the foundation provided the critical pivot, the critical pilot funding that propelled this research forward, and it wouldn't have happened without that funding. So we are immensely grateful. And with that, I will turn it over to Carrie to give a quick summary.
Thanks, Pierce. I think from a big picture perspective, the Magistro gave us funding that, for me as a researcher who had been doing stroke recovery rehabilitation research for about 10 years, it allowed me to go in a little different direction than I had been going. It also allowed me to mentor Pierce to get involved in this. We had a great team, including an exercise physiologist, neurologist, physical therapist, cardiologists, and I think one of the questions that was asked from the registering audience was what steps you took that were most helpful in securing the award. And I think that was one of the most helpful was putting this team together. We had all the expertise we needed, and it was a really unique team. And then finding a really good idea that had been researched enough in different populations, including athletes and heart disease, that looked really promising for stroke. It gave us the ability to translate what was found in those populations to stroke rehabilitation. So I think from a researcher perspective, the foundation awards are just a great way to collect pilot data and not only translate important information to the clinic, but build careers for physical therapists in research. One of the interesting things was when we first started this, people would say, well, it's not feasible. People with stroke won't be able to do this. And in fact, we found in one of our feasibility studies that people with stroke like this better than moderate intensity or better than what they current clinical practice guidelines were in the clinic. They loved being challenged. They loved being pushed. They loved exercising. And it was just really fun to work with people and that were the stroke survivors who were so excited about this approach. So I think that's all we have to say. I think one of the questions is what is the first step a PT student could take towards their path towards becoming more involved in research? And I think if you can find a faculty member to start working with, that would be a great idea. I think Pierce probably has a more fresh perspective than I do on that. Pierce, do you want to speak to that?
No, completely agree. I think getting involved in research that you're interested in or that you could be interested in as early as possible is really critical for kind of shaping your knowledge of what research is, what rehabilitation research is, and getting exposure to the field and starting to build experience from an early stage. I think I was really lucky that I met Carrie when I was an undergraduate student and continued to work with her through, immediately knew I wanted to do research and continued to work and be mentored by her through my DPT and then PhD training. So that I think getting started earlier in research definitely gives you a leg up. But it doesn't mean that you can't start later either.
Thank you, Pierce and Carrie. Really appreciate that and the work that you've done. We'd like to bring Dr. Binder McLeod back to talk about a new feature related to our grant applications this round.
I don't know about everyone. My screen just went blank. I'm not sure if that's true. Liz, can you hear me okay?
You were breaking up, but you are better now.
Okay, I don't know why. That's right. In terms of, first, let me just say a big thank you to both Pierce and Carrie for such a great example of how Foundation supports not only researchers, as well as our profession. That was just really outstanding. Thank you so much. It's great to see how the research work that we support translates into improving outcomes for patients. And I think this is just a great model. I cannot, my screen is blank, so I'm not sure what you're seeing. So I'll just take a guess.
It's showing the rank order mechanisms slide.
Okay, yes. So we are implementing something new this year in that we are asking applicants to not only identify the primary mechanism to which they're applying, but to identify up to 2 additional mechanisms that their work would fall under. We've run into situations where individuals have applied to one mechanism, but they actually they may have come second in that grouping, and we're only supporting one grant, but that work would have been appropriate for another mechanism. This will allow us to really fund the best research across each of our mechanisms. There are a couple things that I just want to mention. One is you need to check to make sure that you, the applicant, meets the criteria for the mechanism. That is, as I said before, for all the grants, you need to be a member of the APTA, but a particular mechanism may require that you belong to a particular component, such as the Pediatric Academy or whatever other grant mechanism you're applying for. So make sure that you are eligible. And the other thing is making sure that you're in the right stage of development. Some of our grants call for new investigators, and some are open to any individuals. The other thing that you need to check is to make sure that for each of the mechanisms you identify as being appropriate, that your project really fits the scope and purpose of that particular grant. It's really the application's responsibility to review the guidelines, purpose, and eligibility for each of the grants. But we just encourage you, each of you, to look across all the mechanisms and see which are appropriate for your grant, and help us to see which would be the most appropriate mechanism or mechanisms to fund your work. Thanks. Liz, back to you.
Hi. And so I'm here to give you a brief rundown of our grants application process. This here is a homepage slide representing proposalcentral.com. That's where you're going to want to go and create a login. And then you can search physical therapy in their search bar. And that will open up our available opportunities for fall of 2023. Right next to them, you'll see a button that says Apply Now, and you just click that, and it will take you to this page to enter a title. You put in a project title, you can title it anything you want, and click the Save button, and then that opens up the steps for you to follow to submit your application. One of the main things you want to look for is there's a Validate button. Push that Validate button as many times as you want. It will let you know what you're missing and what you need to include in order to submit your application to us. We do not see your application until you click the Submit button. But you can hit that Validate button as many times as you would like while you're going through the process, and it will help you to figure out all of the things you need to submit your application to us. And then we have some additional resources available as you progress in your research career and want some guidance. These groups meet and hold meetings throughout the year, and we would encourage you to contact them directly for more information. And they can generally be found by Googling them or taking a look at our events page on our website. And these are great additional resources in the rehab space for grants guidance. There's another slide. Yes. Some implementation science, the American Society of Neuro Rehab, the National Research Mentoring Network, and of course, the National Institute of Health Grants and Funding has more information for you. We just want you to keep in mind that the full application deadline for grants is August, early August. Watch that deadline. It's right now recorded in the Proposal Central system as August 2nd. And we will keep you posted as to if that were to change. There is no letter of intent required for the grants that are not a magistro or the 2 Paris PATLAs, but there are letters of intent that are required by June 15th for those. Thank you, everyone, for joining us. We have a few minutes for questions. You can enter them into the chat box and we'll read them aloud and try to answer them. And if we don't get to them during the webinar, we can follow up via email afterwards. Be sure to stay connected with the foundation in these 5 easy ways: by visiting our website, at foundationforpt.org, connecting with us on Facebook, following us on Twitter, or even on LinkedIn. And be sure to subscribe to our newsletter for updates on the latest in physical therapy research, donors, foundation alumni, events, and much more. We did have one question in the chat about examples of successful applications that we have available. And we do have a frequently asked questions section of our website that also provides this link, but we have provided it on the Facebook discussion. And others, if you need to contact us, we're happy to provide that to you. I think that's about it. We're here to support you. If you want to set up a separate meeting, go ahead and shoot us an email, info@foundationforpt.org, and we'd be happy to get that underway. And thank you all again. We really appreciate the important work you do that supports patients and their families. We are looking forward to helping to support you.